Hi, my name is Dr. Ritha Belizaire. I am a double board certified general and colorectal surgeon and one of the founding medical advisors for Betty Health. How do I know if I have a hemorrhoid or a fissure or both? Well, let's start with this. Hemorrhoids are a normal part of our anatomy. Every human being is born with hemorrhoids. They only get a bad name when they become swollen and they start causing symptoms like pain, itching, bleeding, something like that. As such, hemorrhoids exist in the same person that might have an anal fissure. But the question is, how do I know if my symptoms are coming from a hemorrhoid or coming from a fissure? The way we distinguish these is based on the timeline of your symptoms. For example, an internal hemorrhoid generally doesn't cause pain, but it usually causes bleeding, sometimes can cause some itching and discomfort if it is prolapsing or coming out of the anal canal. That's usually a typical sign of an internal hemorrhoid. An external hemorrhoid can cause pain. If they get really swollen, they will cause a significant amount of pain. These are easy to distinguish on physical exam. It honestly just looks like a tiny little balloon sitting on the outside of the anus. Make no mistake, these things are very painful, no matter the size. The symptoms of an external hemorrhoid that's causing pain usually comes on very quickly. So a patient will notice that one day they just have severe, significant pain and it is not going away. They don't want to walk, they don't want to sit down, they don't want to do anything, they can't concentrate, the pain is so bad. This is different than fissure pain. Fissure pain tends to be pretty chronic, meaning that when a patient comes into my office, they have been having this pain for weeks to months, and the pain is usually worse when they're having a bowel movement. It's usually severe, sharp pain that happens with bowel movements and is accompanied by bright red bleeding. This type of pain tends to last for 15, 20 minutes, maybe even up to an hour after a bowel movement. That type of pain is very typical for fissure pain. So to answer the question, is it a hemorrhoid? Is it a fissure? You really need to ask your colorectal surgeon who can go through that timeline of symptoms and do a physical exam and figure out exactly what it is that is causing your symptoms and then take you down the pathway of treatment.